from our social media platforms. This gentleman is 33 years old, tells him the question that he hates this little bald spot he's getting in the back of his head, that he doesn't want to take finasteride, does not want to do topical minoxidil. He has a cat at home, he's afraid of the cat being exposed, is asking if transplant will be a good option for him. So again, full disclosure here, I'm not seeing him. This is just based on the pictures that he sent and the description of his hair loss. In a situation like that, I would discuss with the patient two things. First, maybe try oral minoxidil, which has no bearing on hormones, doesn't affect dihydrotestosterone or anything like that. So good option maybe to strengthen the rest of the hair, maybe get these hairs here a little bit thicker. It's not a DHT blocker, so it's not going to prevent further loss, but it could make things stronger. And also, he doesn't have to wear it topically. The other option will be topical finasteride and minoxidil, but again, if he doesn't want to do the minoxidil topical, more than likely he won't want to do the finasteride either. But let's say no medication and whether we want to transplant him or not. Well, in this situation, I think could be a possibility. His donor area looks really rich, doesn't appear to have any more hair loss here, but we're looking at a snapshot in time, right? I always have to consider 20, 30, 40 years down the road. And he needs to be aware that if we transplant this area today, it'll look great, he won't have any problems. But in the future, this area here may start to expand, and then the area that we transplant is going to stay stable. Obviously, the hairs are there. But if he starts to thin around or starts to thin in the hairline, we will have to go back in and do more transplants. So without medical therapy, that's the risk that you run, is that you will probably continue to lose hair at various paces, and we will need to do more transplants eventually. The key for this is to judge the donor. So I wouldn't put a lot of grafts in here, doesn't need a lot of grafts. So yeah, it could make it better. He wouldn't have to think about it, it wouldn't bother him for a few years, but it's important to understand that without medication, it's a wide open field here. There's no telling how much hair he's going to lose. So it's all about individually addressing every patient and their concerns. So that's why the consultation is very important. If you want to talk to me about it, explain your situation to me, we will make you some recommendations. Okay? Thank you.